Hello, everyone. Welcome to This Day. It is Monday, August 10th. Now, we do have one meeting today, so you may want to tune in. It is the President's and Vice President's meeting, and that'll be at 10 a.m. And you can certainly take a look at that at lagunawoodsvillage.com/meetings. Now, today we do have Jeff Parker visiting with us. We're going to go over some numbers and some information here locally for Laguna Woods. And then I have some do-it-yourself activities that you could do while you are at home, and you can use things from around the house. So we'll kind of go over that. Let's go ahead and go to our resources that we normally do, the ochealthinfo.com, where you can get all of the numbers, and cdc.gov, which is staying healthy, covid19.ca.gov is where you can follow along with the governor's reopening plans. And then they do have a county hotline, which is 714-834-2000. You could always go to our website, which is lagunawoodsvillagealerts.com, and we do update that on a regular basis. And if you have any questions or comments, you could always email those to info@lagunawoodsvillage.com. Now, let's go ahead and take a look at our weather. Well, we're going to start out absolutely lovely, and by the weekend, we are looking at extremely hot temperatures for our area. So today we're going to end up with 80-62, lots of sunshine tomorrow with 82-64. Then as we get to Wednesday, we're going to start our warming trend, 85-66. Warmer on Thursday, 88-69. And by Saturday, we're looking at very hot, 94-64. So again, we're looking at an even hotter heat wave. Let's take a look at our sunrise and sunset. The sunrise this morning was 6:10. So it's getting later and later in the morning, but of course we will go into our daylight savings here in the next few months. Then our sunset will be at 7:42. And thank you so much to Jules Anderson for this gorgeous photo of Joshua Tree. I really appreciate you sending that in. And if you have a lovely vacation photo that you would like to share with us, please email it to lagunawoodsvillagetv@gmail.com. Now, when we return, we will have Jeff Parker, so stay tuned.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
The all-new 3-row Subaru Ascent. Room for up to 8 passengers. Choice of second-row captain's chairs or bench seating. Standard eyesight driver assist technology. Coming from Kelley Blue Book's most trusted brand for 4 years running, the Subaru Ascent. Love is now bigger than ever.
Irvine Subaru. Get your new Subaru here with 2 years complimentary maintenance included.
This is Dr. Trin from Irvine Clinical Research. I hope that during this pandemic that you're doing well and keeping safe. During these times, I want to let you know that we're still offering memory testing at no cost through Healthy Brain Consultations. If you or your loved ones have concerns with memory loss, you don't need to leave your home to chat with me. We're offering these consultations online. Call us at 753-1663 to schedule your Healthy Brain Consultation video chat. Thank you so much and take care.
Welcome back. I have Jeff Parker here to talk about some numbers and some interesting information about some activities that are coming up later in the month. So thanks for being here. How are you?
Good morning and welcome to the new week, right?
I know, another new week, right? For sure. So what do you got for us?
A couple things. We'll start with COVID numbers. This is yesterday's reported numbers. We have 565 new cases in Orange County. Unfortunately, 6 more deaths. So that's, and then one of the things that has been reported continuously over the weekend and started last week, really, is that there's a real concern about whether the cases are accurate or not because of this backlog up at the state of California. So it's anticipated that we're going to see some ratcheting up of some of the numbers, especially the number of cases that have been tested and the number of new cases that are going to come out.
Right.
But as we move into that and see how that plays out this week, we'll be able to come back and report a more detail. We're still at 42 cases in the village. When I say the village, Laguna Woods, the city. So that's good news. That hasn't changed. But obviously some of the fear with regards to the number of deaths in Orange County, how does that relate? Unfortunately, we don't have all the specifics with regards to that relative to the Laguna. Up on the board is the new identified numbers, and which is good news on the left. And again, this goes back to, I want to, with the hesitation that we don't have all of the new numbers in, but our rate cases are down to 90 per 100,000. We were, if you remember, we were above that. We were in like 125 and 140. So that's good. We're headed in the right direction there. And our testing positive percentage is at 7.7%, which is just under that 8% threshold that the state wants. Now again, critical to that is going to be these new numbers once they get out of the state system. Okay. Now, my understanding is that everything has been compiled now into the new system, so it's now just a matter of getting them out to the counties. Okay. So we'll see those probably this next week. All right. And then the other good news is in the blue there is that our hospitalization rate has gone down. So again, positive numbers. Good. And our ICU beds have gone up. Yep. So those are all good pieces of information. And I want to again congratulate the people in the community as we see these hospitalization rates, and there you can, good chart of it right there. See that going down.
Flattening that we're looking for.
Compared to that we were in June and July.
Absolutely.
You know, coming down in that direction is a good thing. Again, the ICU beds is probably the more critical of it because those are the people that are really, really sick and impact that, unfortunately impact that death rate in the community. And I want to say again, 85% of the people who have unfortunately passed away are in that 55 and over category. Right. So again, thinking about the village here and how important it is to wear masks and social distance so that we don't have a large outbreak or spread of the virus.
Exactly. And you know what, everybody has been great about it, and as long as you're just smart about it, and if you decide to go out somewhere, just make sure that the place that you're going to does have the appropriate measures in place, because some places do not. And so when you get there, it's kind of a shock. So, you know, if they're not abiding, then go someplace else because you really want to keep yourself safe. And then regarding testing, we did have a great interview with Ronnie Andrews from Oncocyte, who helped us understand the various testings that are available out there. So antibodies is still coming, but we don't really have availability quite yet, but there's plenty of opportunity to be tested for COVID-19 as to whether or not you have it. So that is something that you just need to talk to your doctor about if you definitely need it. And then of course, there's always the questions about the testing, because there's a lot of questions about the testings quality, and I know that that's kind of going back and forth. So hopefully our numbers are what we need to hear about, and there isn't too many, you know, false positives and things like that, because I know they're all worried about that. So.
Exactly. And hopefully once these new numbers of this backlog come out of the state, it's not going to be major dramatic shift for us. You know, hopefully Orange County has done a pretty good job of moving in the right direction, and so hopefully it's not going to impact us, because really what that means is it's going to slow down the opportunity to reopen. And, you know, and I know there's a lot of focus on schools right now because we're getting close to the start of the schools reopening. Most of them obviously required to go online right now until they can get past this certain period of having all of their categories off the state list.
Good. Well, let's hope that those numbers are going to be out here soon so we can figure it out.
Exactly. Thanks. Exactly.
Thank you. Thanks. What else you got? I know you are itching to tell us about something cool.
Well, I wanted to mention a couple of things that are going on. Our rec department is working on a drive-in movie, and I know you've mentioned it before. That's August 21st and 22nd. The drive-in movies are going to be at 8 p.m. They're going to have cars showing up at around 7:30. This is over at our village maintenance facility.
Right.
That's at 23081 Via Campo Verde. And so tickets are on sale from 12 to 4, Monday through Friday, and you can call our recreation department for that, and $10 per car.
Right.
And this is sponsored by the Village Community Fund. They've taken a number of the expenses that we had for this operation and have funded it, so that's why we can offset, then keep the cost lower for our residents. So this ought to be fun, nice couple of movies, and the old style of drive-in movie. So it's going to be interesting, and if it works well, then we'll continue to look at how else we can do that type of activity. That way it keeps people safe. They're, obviously families, and, if you're not a family group, make sure you're wearing your mask, and there's the social distancing with regards to that.
Well, that should be fun. In fact, we're seeing a lot of pop-up drive-ins. There's one I noticed down in San Juan Capistrano, right off of Ortega Highway and Antonio Lapata. And right there at the Equestrian Center, they have a pop-up drive-in now. So I think it's great. It's pretty remarkable that we're going back to that era, but certainly welcome, because we all like to see movies.
And it's a great activity to get out there with your family, definitely.
That's right.
All right, the other one I wanted to mention is this week we start our paving and concrete work out there in the community. With that in Calle Sonora, via Buena Vista, via Carroza, Vista del Mundo, and Duvernay, and Biamez. Those are the cul-de-sac areas that are going to have just some active paving and concrete work. So look for our signs and our cones and stuff like that. And then in September, we start our big overlay, which is the main streets where we're doing major asphalt work. We'll start in September. So I'll have a little bit more details about that in our upcoming meeting, so we can give enough information in advance to our residents on that.
All right.
And then finally, next week, I just wanted to mention we'll have a number of televised meetings with regards to what we call version 2 of our budget process. These will be the televised meetings next week, not this week, but next week, for all GRF, United, and Third, to take a look at their final versions of their budgets. They've been working on it very diligently over the last couple of weeks, and working with our finance staff. We've been putting together the numbers, and it's very difficult in this period of time, but I want to assure all our residents we're doing the best to try to keep those assessments as low as possible.
Good news. All right, well, thank you very much.
Thank you.
We'll see you again on Friday.
Okay.
All right. And remember, if you want more information about the drive-in movie, you can always contact Recreation. Stay tuned, and we will have some information about do-it-yourself activities.
COVID-19 is a serious respiratory disease. There are simple steps we can all take to stay healthy and protect our community. Wash your hands for 20 seconds with soap and warm water. Clean and disinfect frequently touched surfaces daily. Cover coughs and sneezes with a tissue or elbow and avoid touching your face. If you do have symptoms like cough and fever, stay at home and call your doctor. When we all do our part, we can keep California healthy. For more information, visit covid19.ca.gov.
At Harvard Eye, we're so happy to be open again to see you for all of your medical and surgical eye care. We're taking great care to protect everyone from COVID-19 by seeing fewer patients, spacing out chairs in the lobby, sanitizing our office constantly, and doing much more. The world is changing a lot, but what hasn't changed is we're honored by your trust and confidence and committed to keeping you safe. We can't wait to see you again.
Under the RadNet umbrella, prostate imaging is one of our most important men's health initiatives. We have an exclusive team of prostate-dedicated radiologists that read thousands of images from all around the globe. The These radiologists are utilizing advanced technologies such as prostate MRI, which offers some of the most detailed visual representations of the prostate gland. When it comes to men's health issues, listen to your body and take a proactive approach. Talk to your doctor, begin screening, and take charge of your health.
As Orange County's highest-ranked hospital, Hoag is the place to turn to for timely information, reassurance, and care in these uncertain times. Our dedicated physicians, nurses, and staff stand ready to safely deliver world-class care, just as we have for nearly 70 years. This is what we do. We are here for you, and we will overcome this together. To access Hoag for all of your healthcare needs, visit hoag.org/trust.
All right, a few do-it-yourself ideas for today. So we have one, create a beautiful vase with your extra pennies. Now, of course, we have a coin shortage, so maybe your pennies will not be used in the future. We'll have to see where that ends up going. But nonetheless, you need an unused vase, pennies, black spray paint, and a glue gun. And what you want to do is you want to spray the vase with black spray paint, and of course allow it to dry. And then you take all of your pennies and you glue them on so that it goes all the way around. So you can see on the right there, they had step 2, and it looks actually really cool. So if you want to bring some copper into your area, you can go ahead and do this fun activity, and then there's the finished product in the middle. So it's kind of cool. Just, something fun to do if you've got a lot of pennies and you don't know what to do with them. How about lining your drawers with your unwanted or used gift wrap? So you're going to need a ruler, wrapping paper, scissors, and a ruler, I guess a separate ruler, pencil, clear contact paper. And the way that you're going to do that, obviously, is you're going to measure your space, the width and the depth. You're going to mark it on the paper with your pencil, and then you're going to cut out your wrapping paper. Now, cut a piece of contact paper slightly bigger than your wrapping paper, and that's so the wrapping paper will actually stick to the contact paper. So you can use both, but have it a little more decorative with your wrapping paper. The next one we have is creating keychains with wine corks. So if you're like me, which I think there are a few people out there who belong to the wine club, you probably have a lot of corks. So you'll need wine corks, split rings, which you can get at like Joann's, screw eyes, same thing, eye pins, charms, and or beads. And the way you're going to do that is you're going to twist a screw eye into one end of the cork, attach the split ring to the loop of the screw eye to create the keychain, cut an eye pin in half using wire cutters or sharp scissors, and use a side that still contains a loop and slide on a bead. Now you push the beaded eye pin into the other end of the cork, and you now have a keychain. So something fun that you may want to have for guests when they come over, or relatives for birthdays, or just something fun to do. All right, we're going to take a break, and when we come back, we're going to tell you about our Monday movie. Stay tuned.
Hello, I'm Barry Arbuckle, President and CEO of Memorial Care. This important message is for our patients, employees, physicians, and our community, and it must not wait. Together, we have flattened the COVID-19 curve by social distancing and other measures. Together, we have prepared for the possibility of a surge in hospital patients, which thankfully we haven't experienced. And together, we have continued to provide exceptional, safe health care to a small percentage of patients who have the virus, and many others with healthcare needs completely unrelated. Together, we must now focus on renewal. Renewal of healthcare services, and most importantly, the renewal of your healthcare. I know some of you are reluctant to seek care as our community adjusts to reopening. You may be ignoring symptoms or delaying important treatment. This is worrisome. delays can lead to worsening of serious medical conditions, even unnecessary loss of life.
I'm Dr. Mark Sackwood, Chief of Cardiovascular Surgery for Memorial Care. I just completed a minimally invasive aortic valve replacement. This patient had aortic stenosis with increasing symptoms of shortness of breath, chest pain, and dizziness. Without surgery, there could have been dire consequences, including potential loss of life. If you have symptoms, please don't delay your care. We are here for you.
Oftentimes, conditions like the one Dr. Sackwood just described are discovered in one of our 4 hospital emergency departments. We know of instances in which patients have delayed going to the ER when they needed to be there.
I'm very concerned that patients with stroke, heart attack, sepsis, or other medical emergencies are delaying care. Let me reassure you, it is safe and critically important that you do not ignore the signs and symptoms such as chest discomfort, shortness of breath, difficulty breathing, or sudden onset of headache. If you think you may be having a medical emergency, don't wait. Call 911 or go to your nearest emergency room.
We want you to be safe and feel safe. That is why Memorial Care is taking every possible precaution to ensure a protected environment for all patients, whether they're in one of our neighborhood health centers, urgent care centers, imaging or surgery centers, or our hospitals.
Memorial Care hospitals and outpatient centers are once again performing scheduled surgeries and procedures covering many specialties, including joint replacement, spine surgery, gynecological procedures, and many others. And we are taking many extraordinary precautions. All individuals entering any of our facilities are screened for symptoms, their temperature is taken, and a mask is provided. All surgical patients are tested for COVID-19 before their surgery. Waiting areas have been reconfigured for social distancing, and we continue to follow the most stringent compliance with disinfecting and cleaning of all equipment and spaces.
These types of precautions are taken in all of Memorial Care's locations, regardless of the service being provided. And remember, most health care isn't provided in a hospital. Memorial Care offers the greatest number of options for outpatient, neighborhood-based centers in our region. You can have your primary care and urgent care visits in person or virtually. Outpatient surgeries and imaging tests can also be performed in any number of our outpatient centers.
All of our outpatient centers stand ready to care for you. Whether your child needs a vaccination, you have a chronic condition like diabetes or high blood pressure, or whether you need an imaging procedure for a sports injury. Whatever your need, we're here.
Memorial Care is deeply committed to providing our employees, our physicians, and our community with exceptional and safe health care today and every day. Please don't neglect your health. You can rely on us as you always have. Thank you for the trust you place in Memorial Care and the honor of serving you.
Welcome back. Well, our Monday movie today is a really good one. Casino Royale, starring Daniel Craig. And I really like all the Daniel Craig's James Bond movies. After receiving a license to kill, British Secret Service agent James Bond heads to Madagascar, where he uncovers a link to Les Chiffres, a man who finances terrorist organizations. Learning that Les Chiffres plans to raise money in a high-stakes poker game, M16 sends Bond to play against him, gambling that their newest 00 operative will topple the man's organization. So that'll be airing at, let's see, 2 with subtitles and 6 p.m. without subtitles. And the movie today is brought to you by Kaiser Permanente Orange County. Great Plates program, you know, it's extended through today, although they may extend it again, but I'll keep you posted on that. This is for home delivery for senior meals, and you do need to be 60 years or older. So if you would like to participate, you do need to apply. So the best thing to do is go to myagewell.org Subaru.org and fill out the application online, or you can call them at 949-382-6099, and that way you can find out more information and find out what the process is. Let's also tell you one more time, reiterate what Jeff was saying about the drive-in movie. Now, it's just great that we have the drive-in movies now. I mean, you see them all over. Like I mentioned, there's one in San Juan. And then we're going to have ours August 21st at 8 p.m., Call of the Wild. And then Saturday, August 22nd at 8 p.m., Yesterday. And it's $10 per car. And you do need to call Recreation from 12 to 4 p.m., Monday through Friday, 949-597-4282, or you could email them at recreation@vmsinc.org. And it just sounds like a load of fun. So call them for more information on that. All right, let's take a look at our weather one last time. It is lovely right up until Thursday. We are starting to get very warm this week. Big heat wave is coming, just like that one week, although this time it might be even a little hotter. So we are looking at warm temperatures by the weekend. Today's temperatures are going to be 80, 62. Tomorrow we will have lots of sunshine, 82, 64. Then we start our warming trend on Wednesday. I doubt we're going to have very much overcast in the morning, 85, 66. Warmer again on Thursday, 88, 69. And then by Friday, we are looking very hot, 94, 74. So it's going to be a little like Palm Desert, although they're even hotter than us. But nonetheless, 74 for an overnight temperature is kind of rare for us. So it should be lovely right up till Wednesday. So enjoy your weather. Have a great day in the village. If you would like to watch our rebroadcasts at 12:30 and 5, you can check it out at those times. Otherwise, catch us again tomorrow morning at 9 a.m. Have a great day in the village. Stay healthy, and we'll see you again here tomorrow. Bye-bye.
South County Lexus, we really are different. We're California's exclusive Lexus Plus dealer. Lexus Plus is a new way of doing business. At a Lexus Plus dealer, you can expect an upfront, negotiation-free, hassle-free price right on the vehicle. The same price you'll find on our website, all the way through the transaction. South County Lexus, we feel this is the way of the future, and this is the way the customer prefers to do business. South County Lexus, your exclusive Lexus Plus dealer. Different, just like you.
I have a brilliant smile because of brilliant dentistry. I love her expertise, her knowledge, her wisdom, and most of all, her patience with me.
We take the extra time to understand our patients' special needs and always perform the highest quality dental work at affordable prices in a relaxing and friendly environment. We perform everything from cleaning all the way to implant and sinus surgeries, all under one roof. Stop in or call and experience the brilliant smile difference.
Tip, toss, take action. Don't give mosquitoes a fighting chance. Don't give mosquitoes a fighting chance.